My name is Catherine Mooney. I am the Senior Health and Wellbeing Manager for South Dublin County Partnership, and what we're looking at today is building on from the work from 2020, the case study that we did around the community call. The community call reached over 5,000 people in South Dublin County. We supported people and we identified issues that were isolation, loneliness, anxiety, and from this, I suppose, the LCDC then also identified that these particular issues were emerging most with lone parents in the area. So we got together and we said, look, we need to really support these individuals. And with the support from SICAP, as a SICAP staff member, and with that contribution from SICAP, we could work together with other teams in the partnership collaboratively. So with the health or the children and families, and with enterprise and employment, we get to support our focus for lone parents. Also within the health and wellbeing, then we could work collaboratively to leverage funds from the HSE to deliver specific mental health programmes to lone parents. Considering the statistics now from the CSO, we have identified that 51% of people in Ireland have been negatively impacted by their mental health during the pandemic. And then if you were to focus that locally, when you look at the In-Betweeners report, you can identify that young people's their mental health, their needs weren't being met. And then you focus then on one-parent families with their report, they identified that 43% of parents' main concern was dealing with issues around anxiety and depression, and things that have never emerged before were now coming to the forefront. Our response now, I suppose, considering the support from SICAP, considering the LCDC and this new statistics, was to work together and provide specific supports for individual lone parent families that are living in the area. And we did that now, and what we're going to do now is the video we have here showcases 3 examples of that.
Hello, my name is David Hamill. I'm the councillor with the South Dublin County Partnership. We've really become aware that the mental health needs of people in our communities have become so much worse since COVID. And so far this year we've offered 500 hours of counselling to individuals in our communities, 41% of which have been lone parents. And thankfully, due to the generosity of our funders, half of my funding comes from SICAP, we are able to offer people however many sessions of counselling they need, so we don't have to cut them off after any period of time. If they need 30, 40 sessions, that's no problem, we can offer them those. People are reporting positive outcomes from counselling. It's really have a positive impact in their life, so we know that it's working. And really, what all of this is showing and what we're becoming very aware of is the huge need for counselling and other mental health services in our communities, which has just become even more pronounced over COVID in the last 2 years.
My name is Galina and I'm the Roma Housing and Health Worker with South Dublin County Partnership. Within my role, I assist the members of the Roma community in South Dublin area to access local supports and services. Some of the clients that I work with are lone parents. Recently, I have been supporting a single mom of 3 young children who was going through a hard time after separation from her husband. Anna has been referred to me by her GP, and through working with the client we have identified that the mom was struggling to provide basic things to her children. At that moment she appeared to be in a very low state of well-being, trying to cope with the challenges she was facing: no financial means, language barriers, no digital skills to apply for services online, isolation. So I have assisted Anna to apply for social welfare supports and housing supports. It was very challenging considering the COVID-related restrictions at that time and not being able to meet with the client face-to-face. So not long ago, Anna's one-parent family payment has been approved, and she was happy, delighted and emotional. I have also referred Anna to the Irish Red Cross and the local food bank for food parcels and baby stuff. Also, I have referred her to the local educational welfare officer to support her with enrolling her son into a local school. Overall, with the impact of the pandemic and with most services moving online, it has become much harder for people with language barriers and no digital skills to actually navigate those services, which has led to more exclusion of these marginalized groups.
My name is Deirdre Ruan. I'm the social prescriber with South Dublin County Partnership. I connect people to local services and empower them, give them a sense of purpose. Normally my referrals come from the GP or from the hospital. I met this lady, she was a referral, a 36-year-old lone parent, and she came to me with a lot of problems. So immediately I introduced her to the services within the partnership, counselling, and to the local employment services because she wanted to explore that. And the Irish Red Cross were the most important agency in this case. They were able to supply food, clothes and nappies to the baby, and that was her major concern. The second concern was around her general health. I introduced her to a GP, she didn't have a GP, so all of that was really important. This is an example of a lone parent of the type of work social prescribing does in order to connect people to the local services. And she's a good news story, a story of hope, but we have more work to do to support these vulnerable people in the community where English is not their first language.